Hello, my fellow VSGers. This is Joe Saint, along with Frankensleeve, coming at you with another quick fact. Frequently asked question. And this frequently asked question is, how much pain should I expect after weight loss surgery? In my case, there really wasn't a whole lot of pain. It was more pressure. As they were wheeling me back into the hospital room from the OR, it felt like I had a tremendous gas bubble right under my breastbone. So I really knew how the guy in the Aliens movie felt as that critter was trying to push its way out of his chest. Even though I did have several stitches from the entry points on my stomach, and I had the staples in my stomach, I never really felt any pain in either one of those areas. It was always the pressure from the gas and the lingering gas that was settling into my shoulders that gave me the most trouble. I would feel these aches and pains in my left shoulder, and then I would feel the pressure from the gas moving around inside my body cavity as it shifted. But like I said, I never really felt any pains from the stitches or from the staples in my stomach. The pain medications they gave me were a morphine drip with a plunger on it so that I could click and self-administer the pain medication as I needed it. But it would only allow so many clicks per hour before it would shut me off. And several times I did use up all my clicks before the hour was over. But I believe it was around the fourth or fifth hour post-surgery that my pains pretty much vanished. I still had a little bit of pressure on my chest, but my pains had gone down from the 8 to 9 level back down to 1 or a 2 at the most. So I don't know whether it was the pain medications or if it was the gas finally leaving my system that eased my pain, but there was no real issues after that. The nurses would come in about every 2 hours or so to have me get up and walk the halls, and I would walk 2 to 4 laps around the hall and be brought back to my bed. I didn't have any trouble getting in or out of bed by myself. There was no pain when I sat up or tried to lay back down, but I was very careful in my movements because I kept expecting it to hurt, and fortunately it never hurt. The only real pain I experienced was the day I was released, the next day. I was scheduled to be released about 11 a.m. in the morning, so the nurses came in and took out my morphine drip and the IV and prepared me for release, but my doctor was late in arriving to the hospital to release me, so he didn't arrive till around 4 p.m. that evening, so I was without any kind of pain medication, and for some reason I got a tremendous case of the hiccups. I must have hiccuped for a good 4 or 5 minutes. It seemed like much longer, like it was never going to end, but when it finally did end, I believed that I had stretched my stomach staples and I was in a tremendous amount of pain. Since the morphine drip had been removed, the only thing they could give me was liquid pain medication, and when the stuff they brought me was in a little disposable cup, and it wasn't even a teaspoonful, but the flavor was so disgusting. I almost threw up when I tried to drink down the first one, and they told me I had to drink 2 of these, and I had to sit there for a minute or two and psych myself up for the second one. It was one of the most horrible flavors I've ever had. It did give me some relief, but the pain never did leave, and so the doctor got there around 4 p.m. and released me, and I had a 2-hour drive back to the house. A buddy of mine came to pick me up to drive me back. He wrote me a script for liquid pain medication, but being that late in the evening, I just wanted to get home. I wasn't worried about getting the pain medications or taking any medications for the ride home, and I really didn't think about it. The ride back was pretty horrible. I was still feeling the pain in my stomach from the stretching, from the hiccups, and it seemed like I could feel every little bump in the road. When my friend would slow down for a red light, I could feel gravity pulling on my stomach, and I had to ask him to start slowing down much further back in order to ease the pain I was feeling. Every turn I felt the centripetal force pulling on me to the side. Every time he switched lanes, I felt it. It was just a miserable trip all the way back. I just remember sitting in the seat, curled over on myself, just wishing it was over, that we would get back and I could get into my chair and start relaxing. Fortunately, there have been other people who have had a wonderful experience. They've experienced no pain. The ride home for them was no big deal. People have flown home the next day with no issues. So it worked out well for them. And I believe if I hadn't got the hiccups, that I would have had a pain-free recovery and not gone through the extra week of stomach pain that I went through for the first week post-op. So that was my experience with post-op pain. This is Joe Saint and Frankensleeve signing off from VSG land. And keep pimping that sleeve.